One of the symptoms service members returning from military deployment report most frequently is pain. As a caregiver, understanding and managing the physical and psychological pain your wounded warrior experiences can play an important role in his or her rehabilitation and reintegration process. Chronic pain is pain that continues beyond an expected healing period for an injury, and it has the potential to significantly affect your warrior during the recovery phase. The pain can linger even if your warrior is no longer ill or injured, and in some cases, even if no illness or injury exists. Chronic pain can come from normal wear and tear on the body or from aging. During military operations, however, chronic pain may come from combat-related injuries or day-to-day military activities. Many service members who sustain less traumatic wounds return home with back problems, joint immobility, or other ailments. Potential consequences if your service member does not seek immediate attention for his or her chronic pain can include suicide, substance abuse, depression, loss of physical fitness, sleep disturbance, reduced sexual activity, lower self-esteem, irritability, impaired ability to work. People perceive and react to pain in different ways. Those who suffer from chronic pain are less likely to be able to perform simple day-to-day activities such as walking, sitting, standing, lifting, or even touching objects. Be aware of signs indicating that your warrior may be in pain. Such signs include distressed facial expressions such as grimacing, heavy breathing, unusual body movements such as limping, behavioral changes such as not wanting to eat or sleep, emotional changes such as irritability or crying. Chronic pain can occur along with another health problem. In these cases, efforts to address the chronic pain can be more complicated. Coping with chronic pain is difficult on both the body and mind, and can be even more difficult if the cause of the pain involves some form of trauma. If your service member has post-traumatic stress disorder, he or she may also experience some form of chronic pain. It is important to address both chronic pain and post-traumatic stress disorder at the same time to improve quality of life and decrease disability. Treating the pain alone will not cure your wounded warrior's post-traumatic stress disorder symptoms. Rather, it could make them worse. The National Pain Foundation suggests that your service member talk to a doctor or nurse case manager about how his or her pain may serve as a trigger or reminder of the trauma, resulting in increased pain and disability. If your service member had a limb or limbs amputated, he or she may experience phantom limb pain, a form of chronic pain that is perceived as real, relentless pain present in the limb that is no longer there. Phantom pain may be caused by sensations generated from the central nervous system, which includes the spinal cord and brain. Nerve endings at the amputation site can send signals to the brain that are perceived as pain, making it seem that the pain is present in the area of the missing limb or that the missing limb is still intact. To determine whether your loved one is experiencing phantom limb pain, talk to your warrior about the amputation site. Ask the following questions. Does he or she feel as though the amputated limb is still present? Is there an itching, tingling, pinching, burning, or throbbing sensation from the amputation site? Is he or she sensing pain coming from areas of the missing limb farthest from the body? For example, from the fingers or hand of a missing arm? If your wounded warrior answered yes to any of these questions, he or she may be experiencing phantom limb pain. Talk to your wounded service member's doctor about treatments available for chronic pain. Treatment varies among patients depending on their specific chronic pain conditions. Potential treatment options for those struggling with pain include acupuncture, massage, physical therapy, medication, mirroring, and nerve blockers. Acupuncture stimulates the body by using thin needles strategically placed on the body and manipulated by hand or electronically. Massage enhances the healing process of muscles and tissues and provides overall relaxation. Physical therapy encompasses an array of movements that increase the body's strength and flexibility and alleviates pain. Pain medications are a common pain relief method for treating chronic pain. But pain medications are not compatible with everyone, and people respond differently to medications. Mirroring is a therapeutic procedure used for amputee patients exhibiting phantom limb pain. Mirroring involves holding a mirror to an amputated area to fool the brain into seeing the amputated area. The patient looking at the reflection of the intact limb in the mirror can see and move their missing limb to minimize discomfort and pain. Nerve blockers are injected along the nerve to prevent pain signals from passing through the brain, stopping the signals that cause the patient to perceive pain. Working together, you and your service member can get through the treatment process. While coping with chronic pain may seem overwhelming at times, military personnel and their caregivers can learn ways to manage chronic pain and restore more productivity and meaningfulness to their lives. Here are some things you can do, whether you are a warrior or a caregiver.
Develop a comprehensive treatment plan with your doctor or nurse case manager.
Keep a folder of your wounded warrior's medical information and bring it to each medical appointment.
Speak up to your healthcare provider, describing the pain and any activities that lessen or increase the pain.
Report any major change you observe in your warrior's symptoms, moods, abilities, or daily activities.
Participate in the treatment process early on.
Communicate with your warrior. Talk about issues and concerns as they arise.
Talk to your doctor or nurse case manager about support groups for warriors in similar chronic pain situations.
Join a support group for caregivers in similar wounded warrior situations.
Track your pain episodes and write down how long the pain lasts, the severity of the pain, and activities that may have brought about the pain.
Believe your warrior's report of pain.
Write down any questions or concerns you may have before each medical appointment.
Attend medical visits with your wounded warrior.
Know your limitations when it comes to overexertion.
Acknowledge the difficulty your wounded warrior may have in accepting new limitations.
Maintain regular sleep schedules.
Talk to your warrior's doctor or nurse case manager if the pain begins to disrupt his or her sleep.
Eat a healthy diet and exercise regularly.
Take care of your own health.
Realize that there will be good days and bad days.
Be patient. Understand when to help and when to encourage self-help.
Learn to relax. Relaxation exercises are one way of reclaiming control over the body.
Learn about and introduce your warrior to relaxation techniques such as meditation, muscle relaxation, and breathing techniques.
Find ways to distract from the pain, such as listening to music or reading.
Look for humor in caregiving moments. It's important to be able to laugh even when those moments can be heartbreaking.
Set realistic goals with your healthcare provider concerning a treatment plan.
Talk with your warrior about hopes you each have for the future.
Your caregiving journey can be physically and mentally challenging, especially if you're caring for a wounded warrior who has chronic pain. Learning as much as you can about this condition will help you better serve your wounded warrior during this difficult time. And remember, never give up. Staying positive will keep your warrior optimistic and help him or her stay motivated during the rehabilitation process.